So we're going to be talking about the evaluation of the Advance project, which involved training and resources for nurses working in general practice to enable you to initiate advanced care planning and palliative care with your patients. This project was led by HammondCare, working in collaboration with various health organisations and universities across Australia. And I'd like to acknowledge our fantastic team of project members as well as collaborators on the project. In addition to Srivalli, who is the project coordinator for Advance, we also have Kelly Arthurs here, who is our palliative care nurse educator. And I'm the palliative care physician and the director of the project. So our project was funded by the Australian Government Department of Health in a National Palliative Care Project grant, and our initial funding was from February 2016 until the end of last year. And our primary target and our sole target clinician group in that period was general practice nurses. And we developed a toolkit and a multi-component training resource to enable general practice nurses to use a structured approach for two main purposes. Firstly, to promote awareness of advanced care planning amongst older people and those with chronic and complex disease, and to do this as part of routine health assessments to normalise the conversation. And secondly, to identify patients within the practice who might be at risk of deteriorating and dying, and in these patients to do a thorough assessment of their supportive and palliative care needs, including assessing their symptoms, priorities, questions, concerns, their caregivers' needs, and finally, to identify which of these patients might most benefit from referral to specialist palliative care services. As part of our resources, we developed a toolkit which was based on the best available evidence and includes a set of screening and assessment tools for nurses to be able to initiate conversations about palliative care and advanced care planning and assess patients' needs. It also includes a guide which explains how to implement these tools into clinical general practice. The final toolkit was endorsed by APNA and also officially recognised as an accepted clinical resource by the Royal Australian College of General Practitioners. We also developed a set of training videos which explain how to use the tools in conversations with patients, free online training modules. We held workshops throughout the country. We also have available telementoring with a palliative care nurse, and we developed a Train the Trainer program. At the end of our initial funding period, December last year, 823 nurses had enrolled in our training program, and about 400 had completed, this is the online training program, and about 400 nurses had completed at least some components of this online program. And this far exceeded our targets. We also had a number of requests to take part in the training from clinicians other than general practice nurses, and we allowed other clinicians to take part on a case-by-case basis. We held 27 workshops across the country, and participants included about 350 general practice nurses, and we had a number of rural and regional participants. Last year, we presented in more detail about the components and the content of our training in our assessment model. In this presentation, we're going to be focusing on the evaluation of the program. The objectives of the evaluation were to assess the feasibility, acceptability, perceived utility and costs of implementing the training program, as well as implementing the actual assessments into clinical general practice, and the perceived benefits and barriers to doing this. And we also assessed the impact of the training on nurses' self-reported knowledge, confidence, attitudes, and self-perceived skills to use the actual screening assessments in their practice to initiate advanced care planning and palliative care. We're only going to have time to just give you a little snapshot of some of the key findings today. And I'm going to hand over to Srivalli, who will give you some of the results.
Thanks, Josephine. To collect our evaluation data, we used a mixed methods approach And we administered surveys at different time points, pre and post training, to understand the impact of the training program. We also conducted semi-structured interviews with general practice nurses with a purposefully selected subset of participants to explore in depth their feedback on the training, participating in the training program, as well as getting a good understanding of the benefits of and barriers to implementing advanced assessment tools in the clinical practice. And as you can see on the slide, we received a really good response for a number of surveys at different time points, and we also interviewed 20 GPNs to get in-depth data. We had fantastic and overwhelmingly positive feedback about the advanced online training. A number of them loved the resources that we presented as part of the online learning modules, and in particular, very overwhelmingly, a majority number agreed that they would, that they really found the online training to be easy to use, easy to navigate, and the information very easy to understand. 98% of them also stated that they would recommend the training to other general practice nurses. And one of the really well appreciated component of the feedback was that the Advance Toolkit, the practical demonstration videos, a number of them stated that they actually bridged a gap in existing resources and training for general practice nurses. At the conclusion of every workshop, we administered paper-based surveys, and we received a fantastic response rate of 91%. And again, overwhelming number of participants stated that they found the workshops to be very useful and that they felt confident to initiate advanced care planning, palliative and supportive care assessments as a direct result of attending the training program. And again, nearly all agreed that they would recommend the workshop to other general practice nurses. We also asked the nurses about how they might use our training. And again, an overwhelming number reported that they would use the tools because the tools would help them to initiate advanced care planning and also to start discussions about palliative and supportive care needs of patients and carers. And once again, I think very positive feedback from the workshops. Just to give you a flavour of what the participants were saying about the training and the experience. One participant stated, "After completing the training, I changed my opinion about the benefits of using the assessment tools. I felt they would be off-putting to the patient and difficult to use in a relaxed conversation. I have to say now, I feel very positive about the use of these tools." Another workshop participant stated, "Great resource to get ACP off the ground in GP land and identify gaps and open doors for patient concerns and care provision. Patient-centred care at its best." As part of the evaluation, we also analysed the impact the training had on the knowledge, attitudes and confidence and comfort levels of general practice nurses. As a direct result of participation in the training program, we found out that there was a great significant increase or improvement in the self-rated knowledge, positive attitudes and greater levels of confidence and comfort. And there was significant evidence of improvements in all these areas after training when compared to the baseline, and these improvements were sustained at the follow-up time point as well. Just to give you an example, we looked at the means for individual advanced care planning, palliative and supportive care knowledge items, and as you can see from the figure there, the bar chart there, you'll notice that there were significant improvements pre-training versus the follow-up. So even for the both scenarios of when we compared pre-training to post-workshop and pre-training to follow-up. And again, these differences were statistically significant. We also asked the participants about how they used the tools and how satisfied they were with these tools. At follow-up, we found out that about half of them had used one or more of the advanced assessment tools in their clinical practice, and most commonly it was the advanced care planning screening interview tool. And nearly all participants who had used these tools in their clinical practice with patients and carers, they were very satisfied with them. I'll now hand over to Josephine to talk about impact on practice and the next steps for Advance project.
So, impacts on practice. In the short period of time between delivering the training and our follow-up, there was already evidence of changes in clinical practice, particularly around advanced care planning, with participants being significantly more likely to have been involved in advanced care planning discussions at follow-up compared to baseline. So at baseline, 55% of the participants had had at least one advanced care planning discussion with a patient. By the time of follow-up, 81% of participants had had at least one conversation, and this difference was highly statistically significant. And of those who are already having advanced care planning discussions with their patients at baseline, they were significantly more likely to have rated their discussions favourably at follow-up compared to baseline. So, and the nurses reported, who had implemented the tools in their practice, reported positive impacts on their patients and carers as a result of having done so. So this, I'll read you out some of these quotes. So the first one here is from a nurse who was talking about using the advanced care planning tools. It's helped in opening the conversation between patients and doctors. As patient advocates, nurses are best placed to act as go-between between patients and doctors. Sometimes it may be difficult for the medical doctor to initiate topics, and the nurses are ideally in the situation to facilitate the conversation. Another nurse here was talking about one of the palliative and supportive care assessment tools. I used this tool when a patient was very upset and appeared to be not coping with her illness. This tool helped her to clarify what was really important for her and therefore what I could help her with. And another participant here talking about using the care assessment tool. We identified that our carers needed some help themselves, and we made additional referrals and booked time for the carer to see the GP. At follow-up, the majority of participants indicated their intention to continue to implement the tools and the skills learnt in the program. There were, however, a variety of practice levels barriers to implementation that we identified. Immediately following training, we found that participants were fired up and very enthusiastic to go back to their practices and implement the tools. As we followed participants over time with our surveys, with our individual tele-mentoring and also the qualitative interviews, we found that enthusiasm was challenged by the reality of going back to practice and having multiple demands on time. It was in the middle of the vaccination and flu season. And there was also, in our qualitative interviews and surveys, the nurses commented that there was just a resistance to change in the practice. And in particular, the nurses said that it was challenging sometimes to get their GPs and practice managers on board to be able to put it into the systems of the general practice. There was also time and funding and cost-related barriers. In particular, we noted that while some nurses identified that there were Medicare items that could be used to implement these assessments into practice, other nurses weren't aware of those Medicare items. So it highlighted the need for education around the Medicare items that could be used. And various participants gave various strategies to overcome these barriers, and we'll be incorporating those suggestions in our program moving forward. In particular, the nurses stated that advanced training should be extended to include GPs and practice managers so that we're educating them directly about the benefits of this program. And in order to enable a systematic and team-based approach to initiating advanced care planning and assessing and addressing palliative and supportive care needs in primary care and general practice. So we're really excited to have got further funding from the Department of Health and till the middle of June 2020. And we'll be providing ongoing support for general practice nurses, including availability of tele-mentoring with our specialist palliative care nurse. And we'll also be developing training specifically for GPs, GP registrars and practice managers, so we can enable this whole of general practice approach. In addition, we'll be developing training for other nurses and allied health staff who work in primary care settings outside of private general practices, but who regularly have contact with patients' GPs. And we'll be adapting the training and the resources to meet the specific learning needs of these new target groups of clinicians. We'll also be offering some grants to enable champion networks to deliver the face-to-face training, and we'll be providing trainer support to those networks and also supporting them to develop local implementation plans which can be exemplar for other networks. And we'll be collecting in-depth data from a subset of clinical sites to inform ongoing implementation, to enable ongoing improvement of the program. So the aims of the program moving forward are to build capacity in the primary healthcare sector, to promote awareness of advanced care planning, and to do this in a systemised way during routine health assessments, and particularly targeting older people and those with chronic and complex disease. Secondly, to support clinicians to identify patients who might be at risk of deteriorating and dying, and then these patients to use a structured approach to assess their needs as well as their carers' needs. And finally, to support a systematic team-based approach to initiating advanced care planning and assessing palliative care needs in primary care, as well as triaging patients who would most benefit from early referral to specialist palliative care services. So in conclusion, the advanced training program was highly received by general practice nurses and had a significant positive impact on nurses' knowledge, attitudes, confidence, comfort to implement practice change in initiating advanced care planning and palliative and supportive care in general practice. In the short period of time between delivering the training and follow-up, there was already some evidence of changes in participants' clinical practice, and progress was seen on implementation. The new training modules for GPs and practice managers will be available from October this year. And we encourage you to avail yourselves of the current program, which is available for general practice nurses. So there's online training, free online training available, which can get CPD points, and also individual mentoring to help troubleshoot any challenges you might be having with implementing the tools into your practice. We'd particularly like to thank APNA, who have endorsed all of the components of the training program, and who've been incredibly supportive in promoting and making sure that members are aware of this resource. And here are our contact details, and would love to hear from you if you have any suggestions for the program moving forward, if you'd like some assistance. And yeah, thank you.
Thanks, Josephine and Srivalli. We've got time for 2 quick questions. Okay, I've got one. But you put it in there, but sort of look at how the plans are implemented. Because you can have a plan, but unless there's, in a sense, a discussion about how the plan will be used, any observations about that?
Which plan are you referring to?
Well, the advanced care plan. So you can have one,
yes,
but it could just sit on a desk and no one knows about it. So any work on that?
Yes, so the key aim of this program is basically to start the conversation and promote awareness of advanced care planning. The end result is not necessarily an advanced care directive, although that might be one outcome. As a specialist palliative care doctor, I can tell you that it makes an enormous difference when a patient is in a situation of a health crisis, when they've had some opening of the discussion previously, where they've had some discussion with their family, whether or not there's a final written document about their wishes. People may not have a final concrete plan. Yes, I definitely don't want those interventions. They may not want to actually write down an advanced care directive. But having at least had the opportunity to begin to discuss this with their family, to talk about what's important to them, what kind of factors they might want their family to take into consideration if at some point they're been called on to make a decision. That was where I see the value of this program. Yeah.
Well, thank you very much.
Can we get the toolkit online? Is it available online for free? Sorry.
Yes, it is. We encourage you, like, we don't have it available just purely to download, because we encourage people to actually do the training so that you can see how it could be utilised. So it is available. It's free to do the online training, and the toolkit, once you've done the training, is like you actually can download it as you go through the program. You get it in stages, and then you get the full suite of resources, the videos. We also have, we've developed Train the Trainer for nurses in general practices so that they can do an in-service with their colleagues to tell them about the program. So the support is there, and would love to hear from you. And if you, we could send you the toolkit, but I would suggest it'd be better to actually do the training so you can see how it could work in your practice.
How long does the training take?
It's a 2-hour module altogether, and you get 2 CPD points at the end of it. And you can get a further CPD point by having the telementoring with our nurse.